This is the inflammation and oxidative stress that triggers neuron death. This is very complex, but what it shows is a bad thing going into the cell, attacking a little vessel in the cell, or an organelle, or like the mitochondria. Your cell is very small, but it has a whole bunches in it that does different things. Your genes, your energy, your cell division. We are now at the cellular level and within the cell in nutraceuticals and in biophysiology. Too much of our approach to medicine traditionally is macro. It's on the outside. Or it's to turn off a warning signal that there's a problem on the inside. There is really not many gene expression potentials for high blood pressure. High blood pressure is a response to an intertension. Something is wrong, I'm alerting you. My rib is out. I'm not very happy at home. My adrenal gland is going down, so I got to give you all the warning signals, and your blood pressure goes up to kind of go for it, help it out, sort of thing. So it's better to approach a patient having blood pressure with what's happening at home as opposed to, let me start you on this medication, and then I can bill for blood pressure, and then it's on your comorbidity list, and it affects your future in getting an insurance plan. As opposed to finding out what is the problem, and then you can put in the chart resolved, isolated, elevated blood pressure, and then the insurance company girl who's looking at your policy will call you and say, what does that mean? Because she doesn't know, her last job was Wendy's. And then you explain that they had an isolated elevated blood pressure, but it's not a permanent diagnosis, and it has resolved. Well, then you will talk to 5 more people and write 2 letters, because, no, you can't get that policy because you have high blood pressure. And then finally someone who actually understands what's going on goes, oh, okay, they can have the policy. But you have to be persistent. Way too true. Okay, and this is another cross-section. You see that thing going like that? Boy, that wowed him too. Okay, this is the normal brain, and this is the walnut-looking brain of an Alzheimer's patient. And that, again, is what I see too often the first time we meet the patient. Quench neuron fire with proline-rich polypeptide. Okay, you got the mild cognitive impairment with the ones I read. Then we go to the senile dementia. And look at the difference between senile and Alzheimer's. Senile is more mini strokes. Alzheimer's is just degradation. Increasingly forgetful. Memory loss becomes more frequent. Poor judgment. Declining ability to reason. Difficulty communicating, and problems writing, reading, and organizing thoughts. They have all the abilities. They're just diminishing. Alzheimer's is inability to follow instructions. You just forgot the instruction. They cannot follow it. Their surroundings, they don't know where they are. Okay? Loss of speech fluency. They can't express that they're losing their memory. They just can't express. Unable to dress oneself. That's a clue when they come in their underwear. Unable to perform simple tasks like tying their shoes or putting them on. And loss of judgment and reason, delusional, wandering, easily lost, incontinence.
I want to go home and get my husband.
Yeah, it's careful. It is. Here is a decline. Here is a detachment. You see the difference? Makes sense, huh? It's a slow progression, and often it's little mini strokes to different areas that start shrinking. This is the brain is shrinking from what I'm going to show you. So they don't lose abilities. They detach from the world. They're not there, and it's just so awful to watch that progress in a loved one when all of a sudden they just don't know who you are, and they don't know what a chair is, and they just lash out and then they hit you. But I have to tell them often, her brain is already in heaven, her body has to catch up. And then you visit mom knowing that that was mom, but that's not mom now, and you have to detach as well, otherwise it will consume you. That's hard. That's a rough transition. Thank you, Esther. proline, oh, I'm going to say PRPs, okay, it's been a long day. Actually pull out. Remember that cell that showed the oxidative stress going in inside, attacking a tubule, and then it goes on the outside and forms that plaque? The PRPs take that plaque and pull it out. And then eventually it's excreted.
Really?
It's fascinating, and it's brilliant research, all microscopy show. And so when you take the proline-rich polypeptide, it goes across the brain barrier, and it goes to the beta amyloids, which the Alzheimer's Disease Society, like the New England Journal of Alzheimer's, supports this approach better than Namenda and Aricept, because it actually gets to the cause of the problem, the shrinking dendrite. When that dendrite, that half thing is actually a flattened dendrite that's pulling apart. It's because the proline-rich, the beta amyloids from the bad thing going out of the cell are pressing down and compressing more. And as the brain shrinks, it also is altering what function is left. So the protein-rich polypeptides pull those amyloids, that neural tangular, and remember the initial study was all about aluminum? Well, that's just what it looks like. All beta amyloids do that, and it pulls it out. And the brain shrinking stops, and they're starting to see some reversal. And that's very exciting. Where without that constant degeneration, the brain goes into a little bit of a repair. This is a electron microscopy of a brain with those deposits and the shrinking. And this is after a month of the poly-PRP. See how it pulled it out?
Really?
And that's exactly what they said in the room. They went, wow. Because you see, we're all trying to enhance that walnut brain, and this is making that walnut brain stop and start expanding. Yeah, that's all about the product, which is called Cognisure, and Metagenics won on this one. Zymogen is winning on cancer therapies, nutraceuticals. Isogenics is a very specific, very powerful cleanse. There are so many new nutraceutical wellness companies that are exploding that it's as hard to choose from it as from a pharmacy list often. And that's exciting to have that many more choices. But this one wins. And it tastes like chocolate. This is the first supplement I've ever tasted that doesn't taste like cat poop. You know, I mean, it's just absolutely wonderful. Now the next one really got their attention.
Star Trek.
Yeah, this is a language lab. We're going to learn Klingon. For those who are Trekkies, like me, yeah, live long and prosper. This teach.
Are you out of your Vulcan mind?
Yeah. And they're going, what is he doing now? He's going to teach us Klingon. You know? This is weird. Well, this goes into the world of neurofeedback, which is a therapy that's been around but now has exploded into a better choice than a medication. The world of pharmaceuticals are extremely challenged right now because you, the patient population, are saying, we don't want to do these anymore. They haven't worked. I still had a heart attack. I feel like, you know, cat poop on all these medications. I'm not thinking clearly, and I don't care if my lab looks pretty. I don't feel well. Okay, so then they're shifting my patient, my physician population over there because their revenue is going down. And that is a real thing because they assume a large risk. They have large expenses, trust me. You know, but you have to cover that, but you have to cover it with a product that works. And the age of pharmaceuticals has proven not to work in every arena. We have mastered rescue, correct? If your blood pressure is critical, we can bring it down. If your thyroid's going down, we can supplement it. We're not very good about bringing it back. We'll just put you on thyroid for the life. If you have bad back pain, you'll be on Celebrex, or you'll be on this, as opposed to fixing it. And then you won't need it. And maybe encouraging repair. Oh no, there's a concept. But no, we just turn off the warning signal of the pain. We got to get to the why. And you guys are guiding us there. So for a while there, they would say, how are you doing, Don? I'm doing very well. You want to know why? No. Oh, okay. You know, how do you answer that? Have another glass of wine. You know, you'll feel better about being broke. You know. So, and then they laugh, but for the first time, my friends from residency, as we make this a reunion at this conference, asked me, what are you doing? And we spent a whole evening talking about nutraceuticals and how it works, and they get it. But they had to get it because their patient population is plateaued, their income's going like this, but their very favorite patients are leaving. And I worked so hard with them. I said, you did really good, but you stopped. You have to go on and repair them. You just rescue them. And that's an interesting thought. When patients get there, especially with chronic disease diagnosis of long term, repair. I was told, we don't know why, and you just take these meds and we'll adjust them if they don't work, correct? Well, how about negating the need for the meds and repairing? And when you keep people in that mode, you also give them ownership to that diagnosis and to, this is who I am. And that's hard to let go because that's become who you are. That's very hard, but when you start doing this approach and they actually feel better, which they were absolutely certain they were destined to only feel so good, and that they just didn't want to slip down here. So on a scale of 1 to 10, they were a 10 in badness. Now a 4 is for life. And if they go to the 6, they have to change med. Well, how about going to the 1 and not having the med? An EEG, we all know, is measuring brain waves. And where do we use it? With seizure patients. Okay? We see the bad wave, and we medicate the bejeebers out of you so you won't express what that irritation wants to do. We don't fix the irritation, we just stop it, your body's potential seizure, with a myriad of side effects. From thick gums, dead bone marrow, and the ability to think. I mean, seizure medications are rough on the body because you're affecting the master gland. Now we take that EEG, which measures all those brain waves, and we put those waves to work. Because each area of the brain has a different wave. We do that on the EEG, so it was amazing to watch them really connect. Because you learn it, and you process it, and you utilize it, and it's done. But now it's being expanded. And this is not a nutraceutical, I go. This is a tool we have, and we're expanding it. So you're watching the arms come down again, and now we're leaning forward. It was just breathtakingly fun, people watching. And they're, oh, okay. And then off we went. So if you're an autistic child, the majority of your electrodes are in the front. Okay, because remember I told you that's where you think and you process and stuff. And the brain waves in an autistic child are going just like that. And so what happens when they get more stimulation? Yee-haw. It just goes nuts, and they flail out, and they kick, and they have to be, and they don't know who they are, so Joey is kicking you, and he's thinking he's over there. It's so tragic. So those brain waves need to be modified. How do we do that? We hook this electrodes up to a computer program. You do not touch the keyboard, and you perform a task. A favorite one of autistic ones is, of course, driving a car, because they'll never be able to drive a car, they think. So they drive the car. The minute they don't focus on the car, which requires the brainwave in that area to be calm, the car crashes, or it doesn't win. So when they start getting distracted, there goes the car, so they go, oh no, I got to focus on the car. And their brain waves come down, and they lock with the desired wave, and the brain wants to lock. So they keep doing that to keep the lock, and it becomes permanent.
Wow.
No meds.
Wow.
Now you're going, this is kind of beam me up, Scotty, or make it so, Jean-Luc. But it's just applying, expanding it. It's just fascinating to watch. So a patient has a stroke, and the homunculus is damaged. We just take the frequency and put it to the other side. Or it's not damaged, and all of a sudden they're walking. And you are giving the messages back to that side that goes, I can do it, I'm not damaged. It's fascinating.